project of the Leeds Cancer Society. And now we move on to Professor Samuels to give her talk on an update on new IDRC funded project, improving household nutrition security and public health in the CARICOM. Welcome.
Yeah, I'm going to try being down this time and see if we can move with the. Okay, so you remember this morning I presented on the Port of Spain, evaluation of the Port of Spain declaration. And so this afternoon, this actually is the follow-on project, the Port of Spain, improving household nutrition security and public health in CARICOM, again being funded by IDRC Canada. And the goal, this was one of the last slides in the previous presentation, talking about sustainable production of high quality Caribbean food. So this actually is a follow-up to two projects. I already told you about Port of Spain, so I won't repeat that, but I'm going to give you a couple slides on the Farm to Fork project, which was a 2011 to 2014 project in 4 Caribbean countries, including St. Kitts and Nevis. And the main objective of that project was to improve child nutrition and health. And it really was an agricultural project which tried to then get the products into the schools, especially in St. Kitts, in order to improve the nutrition of the school children. So there was a lot of technology and training, drip irrigation, etc., food systems, food delivery systems, procurement, etc., and then government and community support for what they were trying to do in the schools. And then they had this agricultural technologies for diet, diversity, quality, and so on, irrigation, mulching, agricultural interventions, and so on. And then they did the school feeding interventions for these foods that they had produced in the local farms. And they tried to get the children to eat more nutritious meals, and they trained the school staff in how to prepare these meals. And so you have an example of some of the menus, and the changes are highlighted. So they would be adding things like steamed carrots and string beans and tomatoes and cucumbers and so on and so forth. So that project went on, and so did ours. And then IDRC asked us to merge the two follow-up projects into this food security project for the Caribbean. So the overall goal of this new project, which began in January of this year, is to build a shared understanding about the systems driving local food production and consumption in the English-speaking Caribbean, and then to implement coordinated packages for and within the national food system. So interestingly, it's being funded both by the health and the agriculture desk at IDRC Canada. And I know nothing of agriculture. I'm the PI, so I'm learning agriculture as I go along. So the research question basically, what are the most effective gender-sensitive ways to improve food security and household food sovereignty and household food security in CARICOM? So we want to improve the quality and diversity of diets, and we're working in 3 countries initially: Jamaica, St. Vincent and the Grenadines, and St. Kitts and Nevis. We chose them because they are countries with different sizes, because we eventually want to replicate throughout the region. And Jamaica, importantly, as an exporter of food to the rest of the region. So interventions you do here could actually impact broader. So we want to, it's a research project, which is more really translational research. We're doing a lot of implementing of things that are known to work, and some other research as well. So one of the things we're going to be doing is engaging with stakeholders across the range. So private sector, civil society, and then our usual partners. We want to design, implement, and evaluate packages of interventions to address key leverage points. Now, the leverage point thing is very important, because there are some areas we believe where a small amount of intervention can have a disproportionate impact. So for example, at the Inception workshop, the FAO talked about the question of market information. And perhaps that is an area that we could work with to actually have a multiplier effect. So we're looking to work with existing institutions and to strengthen what they are doing in order to meet our objective. We're also working with Caribbean Examination Council, James. Thanks for the introduction. The meeting is happening as we speak in Barbados. What we're doing is that we are funding CXC to revise the curriculum of some of their subjects to include NCD risk. And the first meeting is happening right now in Barbados. But we have a big team, and so some of our other team members are there. So that's the kind of leverage point things that we're talking about. And then, of course, disseminate the lessons. So, being a research project, of course, you have to go with the objectives and all that. So the first thing is to collect information. Most of it is going to the secondary data analysis because this is not really about a lot of research. It's more about the intervention packages. So those are the specific objectives. You want to describe by the usual demographics and so on, the factors which influence food sources and dietary patterns. Because we know a lot about the quantitative side of things, or what percentage of these and so on and so forth. What we do not sufficiently know is why people eat the way they eat. We think we know, but we really have not sat down and talked to them and asked them the questions in a kind of focus group, qualitative way where you can probe and follow up and so on. And so this is one of the things that we're going to be doing. And then, as I said, we're going to be engaging with the stakeholders in the food system to find out from them, to sit and talk with them and find out from them, why do you produce what you produce? Is there a way for us to work together to improve the quality of the food that you're producing for the population? Because none of us in this room produce food, I don't think, except for some small farmers. I don't know. But really, seriously, it is these big companies that feed people. And so if we are to change the way people are fed, you have to engage with these large companies. There's no other way around it. So then the intervention part of the project is, as I mentioned before, so the leverage points, and then the dissemination, of course, to share what we have learned, and to have platforms where we can actually educate and expand the impact of the project. So that's the food system that we're working with. A little bit complicated, yes. But it basically, you have your supply chain, you have the food environment, you have consumer behavior. This is an area that we have not paid enough attention to people in the room. You know, healthy food is not like medicine. You can't just say to people, eat, this is good for you. It has to taste good. And we have not done the market research. You know, when the big food is putting their stuff on the market, they spend millions to get the flavor just right and the texture just right. We need to do that also in healthy food so it's delicious. And then you want to eat it. Somebody say expensive. It must taste good. And you see this expensive thing, there, if you go into the supermarket, you can find cheap vegetables, especially if you go into the markets, and especially if you go at the end of the day, when they don't want to take home the stuff and they're letting it go at great prices. But the challenge for us is to educate people as to how to fix it so it tastes great. When I fix vegetables, I season it like I'm seasoning meat. Can I just say, maybe I should say it. You know, lunch could have done that.
Thank you.
A little seasoning, you know, you have to season food like it tastes good, am I right? A little. Moving right along. So we're talking about consumer behavior and their choices, and they choose what tastes good. So we have to produce things that taste good so that they will eat healthy, nice, tasty, delicious food. And then you have the DAG, what people actually eat, and then you have the impact and the outcome, which would be like on your health indicators and things like that. So we're talking about at the bottom, availability, access, and utilization. And at the top, we're talking about the environment in which all of this takes place. So that is your food system, and this is what we're hoping to intervene in. So who would just look? Okay, so the first activity we had was an inception workshop about a month ago in Jamaica. And in the front, you see Minister Tufton, who came and opened that workshop for us as well. We have the funders in the front. I'm there, and then you have Dr. Ziliong from IDRC and FAO's representative, because they decided to fund the inception workshop. They were so excited about the project. So it's an IDRC funded workshop, but the inception IDRC funded project, but the inception workshop was funded by FAO because they're interested in what we're doing. So at that meeting, we made some decisions. We talked about the governance. We're going to be having a project advisory committee, what we call the SWAG, the steering and working group. And then we're going to be having country teams made up of the ministries of agriculture, health, education in countries, as well as their partners, civil society, private sector, and so on. And then we're going to be having our stakeholders workshops in both, one in Jamaica and one in St. Kitts, before the end of the year, where we will bring all the stakeholders, the manufacturers, producers, distributors, consumers, to talk about the food system and what we can do to improve the supply of food. So we talk to them first, and then we'll have the stakeholders workshop later on. Just like with the Port of Spain evaluation, a really large group of researchers, some of whom are in the room. Professor is my agriculture support. And so we're having all campuses of the university are involved with research. University of Technology, McGill and Cambridge. And then the funders, IDRC and FAO. And then our partner and collaborating institutions, ECA, CARDI, CARFA, CARICOM, Healthy Caribbean Coalition, PAHO, and then the Ministries of Health, Education, and Agriculture in the three countries. So it's a little bit of a monster here that we're dealing with. Now, if you just allow me 2 minutes, I just want to share with you a second project, which is called the Community Food and Health Project. Because it's also in St. Vincent, and we chose St. Vincent because we want these two projects to overlap. So this is a project that's led by Nigel Unwin, a lot of you know Nigel. Has a number of partners, including University of the West Indies, as you can see there. And the objective of this workshop is to work with small island developing states. So we're looking at small island developing states in the Caribbean and in the Pacific. And the project is being done in St. Vincent in the Caribbean and Fiji in the Pacific. Sir George has been trying to create this bond for a long time, has been working on trying to get this bond between Pacific Islands and Caribbean for quite a while. So we're making a little progress there. So what is this thing about small island developing states? Whether they are high or middle income, they all share high vulnerability to climate change and natural hazards. They're economically vulnerable, high reliance on tourism, and they're nutritionally vulnerable because they have high reliance on imported foods, and they have very high rates of nutritionally related diseases. If you look now at overweight and obesity in the Caribbean and Pacific, you see they're pretty similar. And then this is a food dependence ratio for both areas. First of all, climbing, as you can see. And second of all, very high. Caribbean is at 60-something percent, I think that is. And the Pacific, both of them in the 60s. My eyes are dim, I cannot see. But 50–60%, both of them. And when you import so much food, you have little control over the quality of the food because you need things that will last. So it means things in a tin for the most part, which means salt and sodium and fat and all of those things. So the CFA plan is to again look at the current data. So using secondary data analysis, evidence appraisals, and then to develop and test methods to say what is the current nutritional adequacy of local diets and what's the contribution of community-based food production initiatives. Who is involved in that and what's the environmental impact? And then to look at challenges and successes, collate the findings, and design a further program of work, because this is a one-year program to seek further funding from the UK government. And so this is just to show you the overlap between the Community Food and Health Project and the Improving Nutrition Project I spoke about earlier. So the evidence reviews, the stakeholder reviews, and the focus groups and in-depth interviews. The Community Food and Health will also have environmental impact and sources of food, and then we will have some other things there that I have mentioned, or maybe not. So there is an overlap between the two projects. They are complementary, they are aligned, they're designed to be that way, and we're hoping to build one on the other so that we can actually see even more benefits from those two. And there I leave you again with Chief Secretary.
Thank you. Alafia, you have